Going on to agenda item number 14, presentation regarding the opioid crisis in Imperial County as presented by Imperial County Behavioral Health Services and the Imperial County Sheriff's Office and the County Health Department. Tag team here.
Good afternoon or morning, board members, and Leticia Plancarte Garcia, Director of Behavioral Health. I would like to thank you for the opportunity to allow us to come and give a presentation on the opioid crisis, that it's affecting our community and in reality the whole nation. Here with us we have Gabriela Jimenez, Assistant Director for Imperial County Behavioral Health. Gabby has been working for the last almost 4 years, no more, Gabby, in the medical organized delivery system, which is putting together a system for the treatment of substance use disorders from scratch. She really has invested a lot of her time and her unit in really putting together a good service delivery system for Imperial County. So she will be presenting on behalf of Behavioral Health, and Bobby Benavides will be presenting on behalf of the Sheriff's Department. So without further ado.
Good morning, illustrious board. We'll still say morning even though it is afternoon. Madam Clerk, County Council, CEO. So opioids and stimulants have greatly impacted our local community. While rates have varied over the years, in 2020 we saw a rate of overdose deaths. That one, right? That one? Okay. Of overdose deaths, hospitalizations, and ER visits higher than the average within the state. The proverbial war on drugs has steadily brought on new facets of combating. So through this presentation, it's our hope to provide more information on the outlook of the crisis here on our local stand fronts. With it, we also want to kind of detail the efforts that have been done by some of our local departments, the Imperial County Departments, Behavioral Health, Public Health, the Imperial County Sheriff's Office, District Attorney's Office, and whatnot, to really highlight what has been done locally. So before you, you have a statistical chart that kind of shows 2020 and 2021. While we do have some stats for 2022, because of the way we put it together, we weren't able to provide all of the stats for 2022, so we only wanted to show you a full outlook of what 2020 and 2021 was. And the way we kind of measured this, and this was put together by Behavioral Health themselves, is considered crude data based on 100,000 population. But when you look at the left side versus the right side on each of the years, you have Imperial County versus the state. And in 2020, you'll see pretty easily that Imperial County was way above average in their fight against fentanyl and their dealings with how we prepare ourselves for the effects before, during, and after of fentanyl itself and the opioid crisis. It should be noted that with these 2022 stats, we're going to kind of detail a little bit of them later, but you're going to see a steady decrease. 2021 brought us a decrease. We put these together with four main facets, and those four main facets are the overdose deaths related to abuse, the ER visits, the OD deaths, the hospitalizations. When we talk about ER visits, when we talk about hospitalizations, we're talking about resources here. When we talk about, of course, deaths, those are also resources, but how you monetize those is completely different. And we'll touch a little more on that later. So moving on, we want to look at how this affects us here at home in the Imperial County. We saw the numbers, so now let's talk about our communities. So in 2020, there are some common denominators in 2020 and 2021 here, and you guys are going to see them pretty straightforward. But as we look deeper into the stats regarding the stimulants and opioids in an attempt to identify the communities greatest affected and greatest at risk, some common denominators will glare to you. Specifically, in 2020, the psychostimulants OD deaths, and psychostimulants are considered the cocaine, the methamphetamine based. Those were focused predominantly on our north end, your Brawley, your Calapat, your Nyland, your Westmoreland. We'll talk about the services for those areas later. When you look at death-wise, it was similar as the OD deaths for psychostimulants. But when you talk about the ER visits, those were pretty much all-encompassing of our whole county. Those didn't have a specific area. It was everywhere. So moving on to 2021, while we did see decreases, we saw a lot of the same things. Our North County area, again, with OD deaths, we kind of added thermal as we went into 2021, was still our major points of worry, of concern, of where we are putting a lot of our resources. Of course, with the opioid deaths in 2021, Winter Haven kind of came into play on this as well. So looking at the emergency room visits, again, it was throughout the county. There wasn't one specific area that overshot another. So opioids, most specifically fentanyl. That's really why we're here today. It's fentanyl and the progression of fentanyl itself. And I think this board knows, I think our community knows what fentanyl has continued to do to a lot of our communities. Most recently this board did receive some letters of support asking from two of our communities in the Brawley community and the Klesko community because of what they are dealing with on a daily basis. So as we look specifically at fentanyl in the Imperial County, most recently, this has been where much of our efforts have been focused. Consistent with what we are seeing on a national level, this has been progressive in modifying the needs of the community, of the population. So nationally, we've seen a lot of what we're doing, but there are some things that we see a little more than what that is nationally. So looking at the stats, looking at the slide in front of you, you'll see of the 328 United States ports of entries, more fentanyl has been seized by law enforcement in Imperial County and San Diego than anywhere else in the nation. Now that's really alarming for us because we always talk about this being a gateway, about this being really a port where it starts, but we're on a national level here. We are seeing most of it come through the most accessible areas that we populate. Imperial County seizures of fentanyl increased 272% from 2019 to 2022. Gentlemen, you guys are numbers men. You know that. You see it. Initially, drug trafficking organizations smuggled relatively small loads. When it started, we're talking little loads. They brought it in with other drugs because other drugs came at a higher cost. Now, supply demand, again, businessmen in front of me, you guys know, supply got much higher with fentanyl, so loads got much heavier. You'll see some of the pictures there on the right. These are local loads. These are stuff that Imperial County Sheriff's Office personnel have been a part of. They've related to as big as a few tons to as small as a few pills. Now, the real alarming part in fentanyl is the fact that you really can't quantify potency. For one individual, it could be one pill. For another, it could be 4. But while they look like Advil, they're not made the same way as Advil. FDA isn't looking at every one of these pills as it goes through. They are being made with different derivatives, sometimes heavier than others. And so when there's a little more fentanyl in that cup of tea, it's much more potent. Everybody responds differently. And this is how we get into, of course, the life aspect of it. So overdose deaths in Imperial County. The number of overdose deaths have varied from 2018 to 2022. And while we have seen a decrease, that 2020 year that we talk about, that was our heaviest year. We had 33 deaths based on overdose that year. That was 38% of all of our deaths. Now, in 2021, we saw a decrease down to 17. In 2022, a decrease down to 13. So what that kind of shows you is the efforts that we are making on the front lines are actually doing their job to keep people alive and to help them. But when you look at a life, there isn't a cost associated with that. We can't monetize what a life is. We love to monetize what this seizure is. I can tell you a bag is worth this, a pill is worth that, a load is worth this. But none of us can talk about what that life is worth. And all of us would sit here and say in a heartbeat that there isn't a number behind that. But we always like to look at the numbers behind that. So We can talk about what the Imperial County Sheriff's Office has done. I went a few slides ahead there. Huh? Sorry about that. And there's been a number of things that we've done operationally to try and combat fentanyl as a whole, drugs as a whole. Easily, we talk about patrol, and that is the first thing that we do. Our patrol side is out in the streets. They're hitting the areas that we know it might be. But it often takes more than that because patrol has to handle calls. Patrol has to go to their other duties as assigned. So what Imperial County Sheriff's Office has done operationally is they've gone about jumping into a lot of the task forces. With staffing being one of the biggest challenges because you don't always have staff to put in specialized positions when you need staff to be on the streets and handle the day-to-day. This is the games that we play. This is the ups and downs of doing the job. But ICSO has assigned personnel to the DEA task force as well as the HSI task force to help combat these issues. Specifically, ICSO in 2015 put together a BCST, Border Crime Suppression Team, to help combat issues like this. Amongst its mission in itself are to focus their efforts to disrupt the flow of fentanyl into the Imperial County and the domestic market. Now, this team is comprised of federal agents as well. This team does specifically try to help be an ancillary force for patrol, for investigations, for our drug teams. They've also joined in federal operations like Operation Pill Crusher. That's a typical one that is ongoing with our federal partners. And these strong collaborations with federal, state, and local counterparts, the goal to arrest and successfully prosecute those responsible for the sales and distribution of fentanyl has continued throughout. Now, in a perfect world, ICSO would be able to allocate more staff to diversify these efforts even more. But unfortunately, while it's easy to monetize the costs associated with the drugs seized, staffing concerns and funding sources to back putting the personnel in such positions don't always equate. So additionally, it's not just about enforcement. It's also about outreach. So on the enforcement side, what do we do for outreach? Well, our crime prevention team, our Sheriff's Athletic League team, they have put together a pretty good curriculum of expansive community outreach and educational campaigns to continually get with the communities. We hit the schools as hard as we can because, of course, we know our youth are the most important thing to us. We hit the local markets, the local get-togethers, so we can push out as much as possible. We use social media as a really big outreach venture for us to try and grab as many people as we can, as many different markets as we can, so to speak. And so presentations at schools, community education programs, all of those are being done on a regular basis. Additionally, we have, of course, the drug drop boxes at all of our stations so that people can drop off prescribed pills, anything they don't want, need, they may or may not find. So internally, what we've done, and behavioral health has done this too, help of public health as well, we have to protect our employees because our employees, of course, are the ones coming in contact with it, whether it is our employees themselves or our long-term stay personnel that happen to be with us. And so ICSO does provide fentanyl processing kits to safely process any known drugs. And now, because of fentanyl being so prevalent, any drug we consider dangerous. We talk about that potency. That potency can go through a latex glove just as fast as it can go right up a nose, and you can inhale it. So we take every measure now to protect our employees with masks, with ventilation hoods, with special safety areas to ensure that we are protecting our people as much as possible. In addition to that, internal policies to address everybody having naloxone, Narcan on them, and our ability to give that naloxone to not just ourselves, but people we come in contact with who are bearing parts of the precursors that may be an overdose.
So I'm going to talk about what Imperial County has been doing. As Leticia mentioned earlier, we became an organized delivery system as of July 1st, 2018. That's when we implemented it. And this allowed for us to expand our ability to provide Medicaid cover services for substance use disorder, because historically, it's always been very limited, the ability to provide certain services that are covered either through insurance or Medi-Cal. And the direct Medi-Cal organized delivery system is a continuum of care that is modeled after the American Society of Addiction Medicine criteria for substance use disorder treatment. The services that are available, as you can see, include early intervention, outpatient and intensive outpatient services, residential treatment services, 3 levels that we currently have, contracted with outside providers, withdrawal management. We do it in ambulatory within our outpatient clinics and residential as well. Medication for addiction treatment to treat opioid use disorders and alcohol use disorders. Care coordination, recovery services, clinician consultation, and we have a contract for recovery residents, usually known as the sober living environment. We have locations, our clinic locations are in Calexico and in El Centro. We have for both adolescent and adolescent and adult SUD clinics. As you can see, there's an error on the address for El Centro. Is supposed to be 2695 South 4th Street. So those are the clinics that we currently have in Calexico and El Centro. The population served, as you can see on this slide, it'll show you how we have continued to increase in the number of individuals that we are serving at our clinics. During fiscal year 2021-22, we experienced a 31% increase from the previous year. For fiscal 21-22, we served a total of 1,151 individuals. During calendar year of 2021, 269 individuals received medication for addiction treatment for opioid use disorder, while in 2022, we served 290 individuals under this service. Currently, in our current caseload, 27.36% of adults who are receiving services at our clinics and 5% of adolescents have a diagnosis of an opioid use disorder in our current caseload. Some of the strategies that we have implemented at Imperial County Behavioral Health to address the opioid crisis and other drug crisis hasn't just been within Imperial County Behavioral Health, but we have also partnered with other agencies such as the Sheriff's Department, probation, local hospitals, schools, etc., to address this crisis. Part of it also is working with the courts. Currently, we have a mental health calendar where a lot of the cases of individuals who are receiving mental health services and substance use disorder treatment are heard during that calendar. And a lot of the times we are receiving court orders to have individuals assessed at the county jail prior to their release. During fiscal year 21-22, we had 132 court orders, while in 22-23, we had 168 court orders. What this means is that that amount of individuals who were incarcerated received an assessment that allowed us to understand what level of care they required. If they needed residential treatment, then we completed the care coordination to get them into a residential treatment facility from the jail upon their release directly into the residential facility. We have a partnership with El Centro Regional Medical Center through the California Bridge Grant. They were awarded, and this allowed the local hospital to be able to provide medication for addiction treatment, buprenorphine-specific medication, to individuals with an opioid use disorder. And what that did, we were that bridge clinic that accepted those individuals into our clinics after they were seen at the emergency department. We have placed part-time substance use disorder counselors to help, with that transition. And we are in the process of developing the same partnership with Pioneers. We have been awarded the Youth Opioid Response Grant 3 times. We were just recently awarded the 3rd grant, and this has allowed us to expand access to medication-assisted treatment services for youth and young adults and reduce the impact of the opioid and stimulant crisis in Imperial County. And this is specifically for youth ages 12 to 24. And it allows for also prevention, intervention, treatment, and recovery services. And we are in the process of implementing contingency management to treat those with a stimulant use disorder, as you saw in the previous data. That's also a huge problem in Imperial County. And what that will allow us is to implement an incentive program for individuals who are testing negative in stimulant and who are also participating in treatment as recommended. Other strategies, we have been selected, Imperial County has been selected to participate in the Learning Collaborate with Health Management Associates, and the focus is optimizing programs and systems to meet the needs of populations with opioid and other substance use disorders. We have invited other agencies who will be participating in these collaboratives. That includes probation as well. We've invited our public health as well. And they will be guiding us as to how to improve these systems of cares. We do a lot of community outreach and engagement from our programs as well as in partnership with other departments. And we have our alcohol and drug prevention activities through the Substance Abuse Block Grant, which includes problem identification and referral, education. We have a Too Good for Drugs curriculum that is done and offered at the local schools. We have a community base where we have implemented an alcohol and drug coalition and other outreach activities, and information dissemination where we provide the community with education on different areas related to substance use. One big accomplishment for Imperial County Behavioral Health is that we have successfully implemented other harm reduction strategies. Aside from the outreach and the education that we have provided to the community to do overdose prevention, the importance of implementing harm reduction strategies across the community, we were awarded to be part of the naloxone distribution project through Department of Healthcare Services. We have the goal, of course, for this is to address the opioid crisis and reduce the overdose death through the provision of free naloxone. So what we do with our naloxone, also known as Narcan, is that not only has our staff been provided with kits, as you can see on the screen, those pictures, those are the kits that have been provided to all of our staff that provide direct services to individuals with substance use problems. We also have it in our clinics, stored in our clinics in case we were to respond to a possible overdose, and we give it to the clients and family members and their peers. We have had individuals coming back, our clients coming back asking for more. We don't ask them what happened to the last one, we just give it to them. And it has been known to us and reported to us that there has been life saves. Our own clients have saved other people's lives using the naloxone that we have provided within the department. Our staff has been trained through the first aid for opioid overdose training at the American Red Cross. And as I mentioned, we have been provided this to the staff. We have received 252 units. Each unit has 2 doses twice already, and we're in the process of applying for more, and we will be requesting a lot more than the 252 units because we've seen how much it's needed. Also, we have provided overdose kits to our clients that include fentanyl strips so that they can test their drug in case it has fentanyl. Many times what we have identified when we've tested our clients, they test positive for fentanyl and they didn't know that their drug had fentanyl. They'll say, I'm not using fentanyl, I shouldn't be testing positive for fentanyl, but the reality is that they took something that was laced.
How much time do you have? If someone took a drug like naloxone, is that what it is? Mm-hmm. It's like within a couple hours, if they take it, will it?
So if they take an opioid and they have an overdose and we respond So it's very important that you respond immediately when someone is presenting symptoms of an overdose. And so when you give them the medication, they usually immediately respond. The overdose is reversed. If for whatever reason they don't respond, you give them another dose.
So how much time? What time?
In between doses, about 1 to 2 minutes.
No, I mean, if you took it and you don't know, what if you're passing out and you don't, I mean, you're dead? Do you
From
have
an
like
overdose, you
hour
mean?
or 2 hours or 3 hours?
So from the time they took the drug to the
Right.
time they have an overdose?
Yes.
It can vary. I mean, they might have
But-
taken something immediately and they overdose right there and then.
But what about, how long does it take naloxone, or whatever it is, to
Respond?
neutralize the problem, the opioid?
It's instant. It's instant. When you give it to them, that overdose instantly gets reversed. But there might be situations when you have to give more doses. So if it doesn't work and if a minute or two passes, you give another dose. The same if you're still seeing that. And then there's also where you can reverse the overdose, but then they might start getting the symptoms again, and then you can apply it again. The problem with fentanyl is that it requires a lot more doses than any other opioid.
Is there a limit on the number of doses you can give?
Not really. And the other thing is that if you are suspecting that they have an opioid overdose, you give them Narcan, and it turns out that it wasn't that, there's no harm to the person. So some local strategies recommendations that we have, and these, we came up as different agencies coming together and having these recommendations. The implementation of harm reduction strategies by all local agencies providing public services. This includes the schools, law enforcement, local medical providers. And what we mean by that is, of course, having naloxone available. We've seen that in schools there's been situations where kids have overdosed. It's so important that people are trained and that they have it accessible. But when we also talk about harm reduction strategies, it's not just saying, okay, naloxone, fentanyl strips, but it's also the way we communicate about people who are living with substance use disorders. That means the stigma that we have associated with that, the way we refer to people with substance use problems, the way we make certain statements, and all of that has to do with harm reduction, because when we continue to stigmatize or judge, people are not prone to coming forward and asking for services. So harm reduction, it's a large strategy. It's not just certain things, but it involves how we as individuals treat others with substance use problems. We are recommending to develop a community campaign that integrates local efforts to focus on increasing awareness, elimination of stigma associated with substance use, and preventing death by overdose. And what we mean by this is every agency is doing different things. We want to integrate that and create a larger community campaign. Of course, support for the implementation of a substance use disorder treatment clinic in the city of Brawley. We currently only have clinics in El Centro and Calexico. Although we do serve the North End population, we've had some difficulties in establishing a clinic in the North End. Support the implementation of a substance use disorder residential treatment facility in Imperial County. We do not have one locally. We contract with outside providers from LA County and Riverside County. That does put some barriers in getting people admitted to treatment. Also, a lot of resources on the county, because we had to implement a transportation unit that takes clients back and forth. But the most ideal thing would be to have one locally. And other recommended strategies that are provided by the Substance Abuse and Mental Health Services Administration is to encourage providers, persons at risk, family members, and others to learn how to prevent and manage opioid overdose. As I mentioned before, this is the responsibility of everyone. Everyone has a responsibility to do this, and educating yourself, it's one step forward. Ensure access to treatment for individuals who are misusing opioids or who have substance use disorder. We brought brochures on our services. It's so important that people feel that comfort of accessing services that others are recommending. If no matter what door they come through, that people are educated on the services that are available and that they're assisted in reaching out and accessing the services. Of course, as I mentioned, ensure ready access to naloxone, as I mentioned before, having it in everywhere. Encourage the public to call 911. A lot of the deaths that have happened are because people who are there with the person that's having an overdose is so afraid to call 911 because they might have been using themselves with that individual. They might have some drugs on themselves and they don't call 911. We have Good Samaritan laws that would protect an individual if they call 911, even if they are under the influence or they have drug on themselves, if the intent of calling 911 was to save a person's life. So we want to encourage people, don't stay quiet, especially our youth. Our youth get so afraid that they're going to be in so much trouble that they will not call. So we want to encourage the community to do that. And encourage prescribers to use state prescription drug monitoring programs. In California, we use the Controlled Substance Utilization Review and Evaluation System, which is CURES, and that allows providers to be able to identify if they have a person that is going to doctor, getting the same control medication of opioids. So we encourage that that is done. Another, just last statement, we are very dedicated into addressing this issue, providing treatment. As Mr. Undersheriff Benavides mentioned, we are understaffed and we're doing as much as we can to do that. We have very dedicated people doing this work, and we want to thank you for giving us the time to present today.
Thank you. Good job.
Thank you. Any questions? Go ahead.